We're sorry for our little delay, technical difficulties. Welcome to our end of COVID-19 and more for employers in 2023. We appreciate your joining us today. This is Barbara Jennings speaking. I'm here with Corbin, Granger, and we're going to be co-presenting today and trying to give you some information on the end of COVID after 3 long years. First order of business is to let you know that we will send you the slides and we will post the presentation on our shiny new website, townbenefits.com. And on the landing page, you'll see links to our webinars and our newsletters under newsletters and webinars. So be on the lookout for that. It'll take probably a couple of days for that to get on there. Now, feel free to put a question into the question chat box, and we will hold our questions until the end. Now, I have to move on to our disclaimer. As I'm sure you know, that Corbin and I are not tax professionals and we're not lawyers. And so nothing that we're in here talking about today is going to be tax advice or legal advice. This presentation is going to be a broad overview of COVID-19 related plan changes and compliance information. And as always, please feel free to contact Corbin or me if you have any questions about what we've presented today. Now, we're also going to be presenting this same presentation to clients. And so some of this relates more to what brokers do, and some of it relates a little bit more to what HR people do, but we felt like you probably need to know about all of these things. And so that's why we kind of made it an all-inclusive webinar. So without further ado, we're going to move on to our agenda and just kind of generally let you know that the things we're going to be talking about today fall into 3 categories. We're going to be talking about benefits, compliance, and then HR, and how all those things have been affected by the public health emergency and the national emergency. So I'm going to start off, and then I'll turn it over to Corbin in a few slides and try to get everything covered. All right, so what has life been like under COVID legislation? It's hard to remember back, over 3 years ago now, to how things were before COVID came into being. And it occurred to me the other day that, we have a significant number of people in our workforce now, what I think are Gen Z workers, that may have come to work for the first time in the last 3 years, and they've never known a world without COVID. And so some of these changes may have an impact on some of those people. So first of all, since the COVID legislation came down the pike, here are the things that really were affected by it. For one thing, we've been living with free COVID vaccines, anyhow, anywhere, in and out of network. Whatever your pleasure was, you could go and get a COVID vaccine and you didn't have to pay for it. The next thing is you could get free COVID tests. So, you just either your employer, your health plan, you could contact the government, whatever mechanism you wanted to use to get free COVID tests. Those have been out there since they've become available. The next thing is our telehealth benefits. There has been an optional safe harbor for telehealth visits that permit first dollar benefits for individuals enrolled in high deductible health plans. As you know, normally for health services, you have to meet your deductible unless they're preventive before you get any benefit, but that was waived during the COVID period. The next thing is we've been living with more robust COVID services offered through employee assistance plans, and those covered items do not complicate the status of the EAP, what's known as accepted benefits. In addition, COVID services provided at no cost did not impact the mental health parity rules. And then finally, we had extended timelines for COBRA, HIPAA, and the HIPAA special enrollment and external review. All right, next, unbeknownst to probably most people, we've been living with 2 kind of parallel emergencies. The one has been called the public health emergency, which we typically throw around the PHE, and the national emergency, which the NE, and both of those have either ended or they're coming to an end. So the public health emergency is going to end on May 11th of 2023. The public health emergency was declared in January of 2020, and that's the law, or that's the emergency that required the covering of COVID testing and related services without cost sharing. And again, May 11th, for all practical purposes, May 12th is when all of that comes to a halt. Secondly, the national emergency, that's actually already over. April 10th of 2023, that ended. And that has been effective since March of 2020. And that created those extended deadlines for COBRA, HIPAA, special enrollment, and other things that Corbin is going to go into in more detail. Now, let's talk about the things for a minute that were affected by the public health emergency and kind of what comes next for those things. So first is the fact that now COVID vaccines that are provided in network, those are going to continue to be covered without cost sharing. The ACA requires preventive services to be covered, certain preventive services to be covered without cost sharing, and that is going to continue for the COVID vaccines. What's not going to be covered is going to be COVID vaccines that are provided out of network. So, we're not sure exactly what all the health plans are going to do, but they may require cost sharing and prior authorization and perhaps medical management. Not required. So they're going to, I guess, I know that the individual plans may do different things with regard to how they're going to cover out of network vaccines. So those are the primary things in terms of vaccines that are going to be covered. Now, more with the HR, your client HR people in mind, the things that are not going to be affected by the end of the public health emergency, most people are probably aware that there was a lot of discussion about employer mandated vaccines back a year ago or so, and a lot of companies were putting into place mandatory vaccines. That is not going to change with the end of the public health emergency. It is still okay for an employer to require vaccines as long as they make accommodations for religious and disability exceptions. So just your clients need to be aware of that. Secondly, there is a CMS vaccine mandate for healthcare employers, and that's going to remain in effect. And there's a long list of the definition or the different types of healthcare employers that are out there. And again, the CMS vaccine is still going to be, the vaccine mandate is still going to be in effect for those healthcare employers. Now, the second thing that we've talked about that we're all used to is the COVID testing that we've all been getting for free. The post-public health emergency health plans may, but will not be required to place cost sharing, prior authorization, or other types of medical management requirements on coverage for COVID-19 testing. And that includes the over-the-counter tests that we've all been getting for free. So no more open access to free COVID vaccines. And again, that's effective. Hopefully none of your clients are going to have folks standing in line at Walgreens at 11:58 on May 11th, because effective at 12:01, that those free tests are going to be history, at least until the next public health emergency. All right, now Corbin, I'm going to turn this over to you. This is Corbin's portion here is a little more esoteric and a little more detailed. So Corbin is going to take the wheel here.
All right, well, thank you, Barbara. So what we've talked about so far are certain things about covering COVID testing, covering vaccines, and in living in the world that we've lived in the past 3 years, it impacted different aspects of health plan rules. It actually allowed health plans in many areas to break certain rules in terms of telehealth as it relates to high deductible health plans, certain employee assistance plans, and certain mental health parity rules. So we're going to go over this briefly. So during COVID, there was always an optional telehealth safe harbor. So that meant individuals that had a high deductible health plan and use telehealth services that were before meeting what we call the minimum deductible, so they may have had a minimal cost share or no cost sharing at all, could still contribute to their health savings account. So remember, normally the rule is if a plan allows services except for preventive prior to the minimum deductible for a high deductible health plan, it's not a qualified plan so that people could contribute to their HSA. Okay, but that was waived under the COVID rules. And for plans that chose it, it made a lot of sense, because in many instances, the only way you could see any physician was through a telehealth option. So I imagine that was relatively popular. Now, this actually began in 2020, and it was extended again beginning April 1, 2022. And if you or your client would like to use this optional telehealth safe harbor, it will end as of plan years beginning on after January 1st, 2025. However, that's not the end of the story. There is, some legislative movement to make this a permanent telehealth safe harbor. So it doesn't mean that the high deductible health plan has to offer this safe harbor. It just means it's optional, and individuals can still contribute to their HSA if the plan maintains this telehealth benefit. The second is what we refer to as accepted employee assistance plans. And that's not accepted as in, Barbara, I accept you. It's really accepted.
Because I'm the exception.
That's right. It's the exception as in other than. And so it's one of those confusing ways that, one of those confusing terms in our health benefits dictionary that causes a lot of problems. But really what it means is an employee assistant plan is considered an accepted benefit if they don't provide what they call significant medical benefits. And the meaning of that means, so it's more like a referral plan. This type of plan doesn't actually offer health visits for free for you or members of your family as part of your employee assistance plan, because that would really be considered a group health plan. And in those cases, they are subject to COBRA, ACA, and market reforms. So we're talking about accepted plans that really are just more like a referral service to doctors, but they don't actually provide for any free medical care. Now, during the public health emergency, this type of employee assistance plan was allowed to cover COVID testing and other services for COVID without creating a group health plan. And why is that important? Just simply because that meant that they could keep this type of plan, but it wouldn't be subject to COBRA. I feel like probably the majority of plans out there are really more the second type of employee assistance plan, meaning it is something subject to COBRA, because we typically see these employee assistance plans offering some level of medical benefits to make it subject to COBRA. But just in case, if you happen to have clients out there with this level of an EAP, you can just confirm with their provider or even the carrier that if they choose to continue covering COVID-19 benefits, because remember, it's really not required under this EAP, that it's not going to jeopardize that status we call accepted. I think it's something that will probably transition naturally back to the way it was before, but it is something in there that we were allowed to ignore for about the past 3 years. And so it's probably going to go back to the way it was at the beginning. So you're going to have an EAP that's a referral plan, or you're going to have one that's going to be considered a group health plan and subject to COBRA. Now, in addition, we have, after the public health emergency, some of the mental health parity rules. For those of you that aren't aware, they have the Mental Health Parity and Addiction Equity Act. That was of 2008. And really, that law, which I feel is a great law, is it prohibits group health plans from restricting mental health and addiction benefits so that it results in like a lower level of coverage, or they apply treatment limits that are required for medical health benefits than for medical and surgical benefits. So it's an analysis that the group plan does. So for example, you want to have, if somebody enters a facility for mental health or addiction benefits, on some level that treatment can't be lower or have treatment limits applied than it would apply to, for example, if they had a surgical benefit. And group health plans actually test their plans each year to prove that the mental health benefits are on par with medical. The reason for that is the Department of Labor can request that test, and you have to offer it if it's requested. During the PHE, or the public health emergency, health plans again were allowed to cover COVID-19 testing and services without cost sharing. So what that means is you now have a health plan that is providing a higher level of benefit for medical coverage because they're covering COVID-19 testing and services with no cost sharing, but they're not making any changes to the mental health and addiction benefits. So it was providing a greater level of benefits for medical and surgical. So moving forward, plans can't cover these COVID testing and services that result in greater benefits being applied to medical versus mental health. But again, there is no requirement either for plans to cover COVID testing after the public health emergency ends without cost sharing. So this to me also looks like an issue where it's going to revert back to the prior mental health parity rules. But if you did have a concern, especially with a self-insured plan, where sometimes you have to have an outside provider do that test for your mental health benefits, you could check just to confirm that those rules are going to be on par again, and they're not going to cover COVID-19 testing in a way that's going to throw it off. So that's a long way of saying I believe that we're going to revert back to the world we had before. Now, we're going to change gears a little bit and talk about the end of the national emergency. That was actually ended on April 10th, 2023 by President Biden. He signed legislation ending the national emergency earlier. Now, the national emergency, unlike the public health emergency, things don't end exactly on that day. And the reason for it is we need to give individuals time because these deadlines have been extended. So during this national emergency, additional time was given so that plans could give out certain health plan notices. And even if plan participants, or if it was COBRA, they were a qualified beneficiary, they had a timeline to have to make certain things happen. Those deadlines were extended greatly simply because COVID disrupted the ability for required deadlines to be met. I mean, it disrupted the ability to work in the way we had before. So it's obvious that it made sense to provide these extended deadlines. So for example, if you were a plan participant or a COBRA qualified beneficiary, you weren't limited to that 30, 60, 45 day or whatever the deadline was. So it related to HIPAA special enrollment. So for example, adding a newborn to your policy, that normally is limited to a 30-day deadline, but under the national emergency, it could be extended out greatly. Also for what we call external review. So if someone got a health plan decision that wasn't in their favor and they have the right to have that appealed by an independent TPA, that was on a longer deadline period to allow that process to happen. And last, the COBRA timelines for electing. So that 60-day for electing, that 45-day for paying the initial premium, and that 30-day grace period when you're paying the premium on COBRA payments was extended. All of this extension of deadlines is referred to as tolling. it would be easier to call it extending, but of course they came up with a fancy word we call tolling. And all tolling means is that it created a specific time frame. So each person, or if they were on COBRA, each qualified beneficiary had their own deadline. And it was either a year, and that went back to March 1st, 2020. So if someone had an issue in, they experienced that in 2020 or 2021, that year has expired. So now we're really looking at 60 days after the end of the outbreak period. So unlike the public health emergency where things end as of 11:59 on May 11th, we have this term called 60 days after the end of the outbreak period, which is anticipated as June 9th, 2023, but it may be extended a little longer. And again, the reason for that is once the emergency ends, they just didn't want to give people and say, that's it. If you were working within that timeline, thinking you had extra time to make that payment or elect COBRA, it's over. So they extended it a little bit. So we have an example here. We're not asking you to memorize this, just so that you know the process, because it will still impact some individuals. So if someone was required to make a COBRA election by June 1st of 2022, this deadline, we know, was told to the earlier of June 1, 2023, because that's going to be their year. However, the national emergency was ended on April 10th. So now they have 60 days from the end of the outbreak period in order to meet these deadlines. So in this example, the new COBRA deadline for someone with a June 1 effective date for electing actually extends out 60 days after June 9th, 2023, which is August 8th, 2023. And if this sounds confusing, it is. But the important point really to know here is that these longer deadlines are no longer going to occur. However, I know people may think, well, who would pay all their back premiums back to June 1, 2022? And that truly is probably unlikely. But you have that, let's say you take, for example, an individual who should have elected COBRA in June. 6 months later, they're in a horrific car accident or situation and they have $500,000 in medical bills. It would be worth it to them to, if they could, to go back and pay that premium back to June 2022. And then all of those claims incurred would be covered on a retroactive basis. So they wouldn't have coverage until they paid the premiums back to the June 1 date, but it provided them some level of protection. I can tell you we didn't experience that here through our COBRA administrator, but I imagine somewhere around the country it's happened.
Surely somebody has experienced
Yeah, it's probably what we call an outlier, but I'm sure someone had experienced it. Now, you might be asking yourself, well, what are my clients going to do about this? What do they have to do? And really, plans aren't required to notify the participants about the end of the national emergency or the public health emergency, but we feel it's a good idea that you let people know, especially as Barbara pointed out, there are people that have never entered the workforce during the COVID-19 and don't know anything differently. Or if you're my age, you may have forgotten the way the world was before. But so it's probably a good idea to do a communication and just say, look, cost sharing is going to apply for COVID-19 vaccines. If you get them out of network, you're probably going to have cost sharing for COVID tests. Now, that doesn't mean, I believe the CDC has what they call, quote, unquote, free COVID tests. So I'd recommend anybody out there, they can go ahead and still request those tests and see, as long as I think they still have them available at the CDC, they'll probably send them out free of charge. Now, if a plan amended their ERISA plan documents and or summary plan description, so if they went to that extent to amend them to incorporate these changes, then they need to amend it again and issue what we call a summary and material modification. In most cases, that's probably not required. You can notify people about the end of the suspended timeframes, you know, the HIPAA special enrollment, the external review. It might be easier just to make a general statement along with the COVID-19 tests that the deadlines, if you had extended deadlines, are going to revert back to the normal process. And if you use another COBRA administrator other than Beneflex, where they actually changed their COBRA notice and provided these individual deadlines, or changed the notice to that effect to these individuals, you might want to ask them what their process is for handling that. At Beneflex, what we did is we created a generic insert explaining the terms and explaining how it worked and what would happen when the national emergency and the outbreak period ended. But that meant that we really didn't have to go back yet again and reissue any sort of COBRA notices. So with that, I want to go into a little bit of some 2023 compliance updates. Now, the Transparency and Coverage Rules and the CARES Act and the No Surprises Act is probably some of the most significant legislation that we've seen since the Affordable Care Act was enacted. And we did a presentation on that act last year in June of 2022. So I'm going to touch base just briefly on what we call the machine readable file provision, as I sometimes get questions on this. So we had these transparency and coverage rules come out that said you have to have machine readable files to be posted publicly on a health plan website for the consumer. So these files are supposed to show, or they show, in-network costs for providers, out-of-network costs for providers, and billing. Was supposed to show prescription drug information, but that was delayed. Now, the reason for posting these files really wasn't so any of your clients could go look up information as it compared to their plan, because it's so much information. There's actually a transparency and coverage tool that allows them to do that. This was designed to be posted publicly, so all these great fancy IT companies out there could take this vast amount of information and cull it down and turn it into something usable, so that they could compare the cost of this doctor or the cost of this hospital. And there have been some significant charge differences relating to that. The reason for posting it publicly, obviously, is if providers and hospitals have that information out there, then much like the grocery store, where you go and you can see the price per ounce and then the retail price, it's going to hopefully create that market pressure to put a less competitive provider in line with other providers to be more competitive. So the goal of this really is to bring healthcare costs down across the country. Now, the posting burden actually falls on the carriers for these fully insured plans, and that should be included in the contract. Now, if you have a self-insured plan, the TPA can also host the files, and that should be spelled out in the contract. This is more complicated if you have plans that have multiple TPAs. So sometimes you can have a fully insured plan or a self-funded plan, and maybe you have a separate pharmacy benefit manager carve out. That would be an example where you need that vendor's information as well. So what I would recommend you do, if you have a question, you can check with your TPA to see if there's any requirement for the health plan website to post a link. Most health plans do not have a website. And so if there's any requirement that they want on the employer, if they don't have a public website. So I do also have information from the different carriers and TPAs on that, if you'd like to reach out to me if you have a question as well. But that's just a simple revisit on the machine readable file provision. It's a little cumbersome, but hopefully on the long run, it'll bring down costs for us all. So the RxDC reporting, is also a newer provision. RX stands for obviously prescription, DC stands for data collection. Now, this is a requirement that by June 1st annually, and let me back up a second, the first reporting was required to be done by January 31st of 2023 for the 2021 and 2022 years. And CMS applied good faith relief for that, and it has since been taken away. So now, by June 1st annually, health plans and issuers must provide prescription drug information to CMS. It's in a format they call D1 to D8, and there's an instruction manual on the CMS site. But basically, you're reporting to CMS what the plan pays for prescriptions, what drugs accounted for the most spending, what rebates were you received from manufacturers, and more information. These reports have to be submitted through an online portal maintained by CMS. And the reason we included this in the presentation is that not all carriers and TPAs handled this the same way. So a number of carriers sent out surveys to some, but not all of their clients requesting some information. It's possible that your client's server may have blocked that survey. It's possible that the client never even saw the survey or dismissed it because they thought it wasn't important. And the problem is those surveys had a deadline on it for the carrier to go ahead, or the TPA to go ahead and submit that information to them. So as this is so new and the dust seems to be settling, and everyone's struggling with how to comply with this, the best approach we can think of is to create a client list, send it to your carriers or your TPAs or PBMs, whichever you use, to get them to confirm that they are submitting these RxDC reports for your health plan for your clients. If they aren't, then it falls on the employer to submit the information that they're not submitting, and it isn't necessarily an easy task. There is one company out there that we know of that does submit it, that we could pass on to you. We are not proposing they are a vendor of ours, but there may be some options out there. And the reason is the penalty can be up to $100 per affected individual. Now, CMS has said that the relief no longer applies because this has never been enforced before. We don't know to the level that CMS would have enforced it. So we would just recommend that you can confirm compliance, because they won't tell us, the agency, on your behalf. Also keep in mind, if a company maintained two plans, so they had a non-calendar year plan and they had different carriers, you might want to confirm that the information was reported by each entity for the period of the year that they maintained the coverage. All right, so now we move to something called the gag clause attestation. Again, much like the machine readable files that tries to push transparency and cost, this provision is the exact same thing. And basically, no longer can plan and issuers contract with providers and third-party administrators when that contract excludes them from providing information about their provider price or the quality of their care or de-identified claims. So basically, this information now has to be made public. And in the old days, what we called that was a gag clause. So you could actually keep the provider from listing any services. And so it would fall, in my mind, behind this iron curtain. And so they're bringing all that out back into the light. Again, the idea being that you're pushing competition among providers. The health plan or the issuer must submit this attestation to CMS by December 31st. It's another online portal. Now, the carrier or the TPA is the one who's contracting with these third-party providers. So I imagine, they're the ones that are going to be submitting these gag clause attestations to CMS, but we haven't actually received official information regarding that. We've requested it. So at this point in time, I'd like to let you know that look for information on that in our town benefits newsletter, TFA benefits newsletters on our website, or from information from the carrier or TPA on how they're going to comply with this requirement. But that's what the gag clause attestation is. So lastly, there are some changes to the 1094, 1095B and C reporting. So as a review, you know, all self-funded or what we call level funded plans are considered the issuer of coverage, and they have to report individuals covered by the plan annually on a 1094, 1095B. So they have to provide the forms to the individuals. They are also responsible for filing those forms to the IRS. And that's the part we're actually talking about today, how it's going to be filed with the IRS. Now, in addition, applicable large employers have to report full-time employees as to whether the offer of coverage was affordable or minimum value, or if they even had an offer, using these 1094, 1095C forms. And they also complete Part 3 if the employer maintained a self-funded plan. So the threshold for filing electronically has been reduced from 250 returns to 10 returns. So if you think back to those 1094, 1095B forms, I know probably the majority of clients using those forms have filed those by paper. That will no longer be allowed unless they file less than 10 W-2s for the 2023 reporting year, which would be filed in 2024. So that's 10 total. So you could have 10 employees, lose one, gain another, and you're going to be at 11 W-2s. So we want you to, again, maybe make a list of your self-funded and level-funded plans that may need to file electronically. There are methods to do this. They can qualify for their own TIC code to file it through the AIR system at the IRS, or there are also electronic services available routinely for that, and we have a number of companies that provide that service. But it's very important. So for the most part, only very, very, very small self-funded clients are going to be able to file the 1094 and 1095B forms in paper to the IRS. And so with that, I'm going to change it back to, oops, and move back in time. We're going to go forward and look in the future in terms of what's happening on the HR front.
Yes, and I appreciate that. This is Barbara again, and I have put this little section of our presentation that really I only got a few items to cover, but in my HR career, which has spanned several decades, I really don't remember having so many HR issues. They're just kind of in limbo, hanging out there. And these will have the potential to affect clients. Certainly not all of them are going to affect all of your clients, but these are things that your clients should be aware of. And as I said before, we're giving this presentation on Thursday to our clients. And so hopefully it'll just help them come to terms with some things that they just need to know might come down the pike. And you may be interested in these things as well. And most of these things are topics that we may even get questions. I may even get questions from clients for some guidance on how do I navigate this or that. So the first thing is there's a change that's potentially in the works regarding the pay and the definition of what is an exempt employee. You are probably aware of the fact that there are employees that are not entitled to time and a half overtime pay. Generally, we think of these as being more white collar, professionals, that sort of thing. Those are more commonly your exempt employees. And what's happening is, for the past, oh gosh, I'm going to say 6 or 7, maybe, yeah, it probably goes back about 10 years actually. When the weekly minimum salary of an exempt employee was increased to $684. And what that means is that in order to be exempt from overtime, your employee must make at least that much per week as a guaranteed salary. That's being looked at right now by the Department of Labor. And the second thing that you take into consideration when classifying people as exempt or non-exempt is the duties that they actually performed. There's a misunderstanding among managers sometimes, and even business owners, that if I pay this person a salary and I call them salaried, then that means they're exempt, and that is not true. It is based on the duties that they perform and the dollar amount that they get paid. So what's going to happen here is that these are being reviewed, and there may be adjustments in both of those coming up. As my final line there says, the DOL announcement has been long awaited, and we're still waiting. The little disc is still spinning on that, so that may come to fruition sometime in 2023. And it will mean some adjustments, for your perhaps your business owner clients, because it could increase their payroll costs, either having to raise people's salaries in order to keep them as exempt. So it's going to be interesting to see what develops. The second potential thing that some employers may experience is those who rely on independent contractors. And what is the difference between an independent contractor and an employee? Well, this has become a hot topic because we have so much impact of the gig economy that are driving this. So many of these folks that drive for Uber, DoorDash, that sort of thing, they are now considered in most states to be independent contractors. What that means is that as an independent contractor, they have to pay their own employment and payroll taxes, and they're not entitled to employee benefits with the company they work for, and they don't have any type of legal protections like FMLA and that sort of thing. So up here is just a list of kind of what we run down if you're weighing whether this person you're engaging is going to be an independent contractor or an employee. You kind of have these 6 tests to go by. How much control do you have over the employee? How permanent is the situation? Is what they're doing an integral part of your business? And you look at the totality of these circumstances in order to come up with a decision about whether they're an employee or an independent contractor. The new rule the potential new rule is going to make it more difficult to classify people as independent contractors. So I don't think there's really any way to tell exactly what this is going to look like, that even though the DOL has articulated the new rule. In practice, I think it's going to be one of those things that the little time is just going to have to go by, and employers are just going to have to see if their classifications fly. So, will the new rule be implemented? Well, we'll just have to wait and see, but it is something that employers should be aware is out there and that might make a change, because once again, this has the potential to have a pretty large effect on an employer. If all of a sudden, let's say Uber had to start paying the payroll taxes on all their drivers, and they had to provide health benefits for all their drivers and all that sort of thing, you can really see how the employer's costs could go up. On the other hand, you can see why the drivers would want to be classified as employees, because they would derive benefits from that, obviously. But needless to say, it would affect the cost of an Uber ride for sure. Next, we have what's called the I-9 temporary rules. You're probably aware that when a new employee comes on board with an employer, there's a form that needs to be filled out, and that's called the I-9. And historically, the new employees, first of all, it is required and remains required that you prove that you're eligible to legally work in the United States. And there's the list of documents that you can provide to prove that you're legally eligible to work. Historically, employers have had to physically examine these documents. You haven't been able to do this remotely. Well, the pandemic changed everything because, you know, a lot of businesses stopped having people come on site. It became difficult to actually expect people to come in and produce their documents. And so the INS, or Department of Homeland Security, allowed this to be done remotely, so you could have the people send you copies of their documentation. And when it was announced that this was going to go away, employers objected to changing back to the in-person review of the documents because, as we all know, there are still a lot of people working remotely. You have people working probably in multiple states now that would have been under one roof right here in Virginia. And so the flexibility rules were extended through July 31st of 2023. And right now we're still waiting to see if those are going to be made permanent. And obviously we hope we'll know before August 1st. Now, the Department of Homeland Security, and this is another thing that your clients need to know, and again, I'm gonna do this for your clients, so hopefully we'll answer some questions for some employers. That right now, the way things stand is if this thing expires, employers are gonna have to go back to all those people they hired during the pandemic and to not look at their documents in person, are gonna have to go and now look at those documents in person. And you can see that little quote from the Department of Homeland Security that employers are encouraged to begin at their discretion the in-person verification for those employees who were hired on or after March 20th of 2020. They're recommending that you start that now because otherwise you may have quite a job on your hands to try to get all that done in 1 3-day period. So we'll see what happens there. But at least employers, it seems to me, if I'm looking in the crystal ball, that there's got to be some middle of the road compromise on this, either more time to inspect those documents or permanency of the temporary rules. But again, hopefully we'll know before August 1st. Next, we have what is a sea change in the idea of non-compete agreements. I doubt that most of your employer clients use non-competes. Now, a lot of times in the tech and scientific industries, they will use these things. But you know, what is a non-compete agreement? Well, it's a contract between the employee and the employer, where basically the employer says for the next 2 years, you cannot work in this industry within a 100-mile radius of our company. And so you're sort of tying the hands of the employee in terms of being able to be hireable at a job in the geographic location where they're currently living. And then one of the primary uses for that, of course, is you kind of have this overlap between competition, where you want to limit your employees' ability to either compete with you directly by forming their own company or going to work for one of your competitors. And then the second thing is you want to obviously protect your trade secrets and your intellectual property. And so you have people sign these agreements, employers sign them in order to just really protect their competitive advantage. So what may change, and this I called it a sea change a second ago, and it really is that now the Federal Trade Commission has proposed a rule which now would generally prohibit employers from using non-compete clauses, period. So specifically, the new rule would make it illegal for an employer to enter into or attempt to enter into a non-compete with a worker, maintain a non-compete with a worker, or represent to the worker that under certain circumstances that worker is subject to a non-compete. The proposed rule would apply to independent contractors and anyone else who works for an employer, whether they're a volunteer or whether they're a paid person. It would also require employers to rescind any existing non-competes and actively inform workers that they're no longer in effect. Now, they're differentiating the pure competition non-competes with the non-disclosure trade secrets, intellectual property protections, and that sort of thing. Now, as states have been wont to do for the past decade and a half, many states have made their own state laws about a variety of human resources issues. Virginia already has a ban on non-compete agreements, and several other states have as well. So as of July the 1st of 2020, Virginia employees may not enter into, enforce, or threaten to enforce a covenant not to compete if an employee earns less than, in 2023, it's $1,343 per week or $69,836 per year. And the point there, of course, I had heard of employers getting non-competes from people who were fairly low paid employees. And I think the theory is that you're really unfairly tying the hands of someone who can't just easily up and move to a new geographic location in order to get a job in their industry. And so this is a Virginia law, and the only thing that could further affect this Virginia law would be if the federal law adopts the new FTC rules. Depending on how they sort out, you could end up with this Virginia law sort of being nullified, because as is normal with human resources laws, if you have two conflicting laws, a state and a federal, you almost always go with the law that provides the greatest benefit to the employee. So if the new rule goes into effect and it's more advantageous than the Virginia law, then the federal law would prevail. However, if the Virginia law is more advantageous to the employee, then that will continue to prevail. So again, that's just a little information out there for employers to keep in mind if they use non-competes for their employees. Now, this final one, and this is kind of the end of the road for our discussion today, but I just wanted to, I'm going to bring this up to employers to let them know, for one really important reason, that there is an important case that's before the Supreme Court now, and I believe it's going to be probably, I think arguments are being heard sometime in April, and then I think it'll be decided sometime this summer, where I know probably we all became familiar during COVID with the idea that, particularly related to the vaccines, that employees could apply for a religious exemption if they did not want to take the vaccine because of their closely held religious beliefs. And so this case revolves around a postal worker who did not want to work on Sundays. And the Supreme Court decided to hear this case and rule on it. And here's the crux of the issue is this. The Title VII of the Civil Rights Act had said that you could not discriminate against employees on the basis of religion, and you had to make accommodations unless the employer would endure undue hardship by making an accommodation. Well, that law does not define what an undue hardship is. And so in 1977, in a case before the Supreme Court that came before them, the Supreme Court ruled that basically an undue hardship was a very low bar. And so it has been easy for employers to reject these religious exemption requests because they didn't have to prove that it was really a very big hardship. This case is going to come before the Supreme Court, and the Supreme Court, in looking in the crystal ball, I and a lot of other people out there are saying that the Supreme Court may well raise the definition of undue hardship and make it a much more difficult bar to get over in order to reject an employee's accommodation request for a religious exemption on something. Now, so this, to me, this is the important takeaway of this slide. The second section there that says, what should you do? As an employer, from the point at which the Supreme Court rules on this, and if they do rule more favorably toward a higher definition of undue hardship, then employees need to take that seriously, and they need to begin to engage in an interactive dialogue with the requesting employee that's sort of like what the ADA requires, the Americans with Disabilities Act. And that means to sit down, talk to the employee, go back and forth about what type of reasonable accommodations might be out there that the employer could provide to the employee. And, you know, this could be whether it's, I don't want to work on Saturday or work on Sunday, or, whether it's I want to wear a particular symbol on my clothing or whether I want to wear particular clothing. It's hard to picture exactly what could come up within a workplace like that. But the employer, in my opinion, would need to take this request seriously and act like it's more like an ADA request. And then document the process you've gone through. And if you deny, even if you accept the request or deny the request, you need to document why you determined the way you did about affirming or denying that request. So that's just something that your employer clients may encounter. And again, we're happy to talk with people and try to help them talk through situations that they're unsure how to respond. So I believe that we may have some questions out there.
Yep.
And let's see, let's get our let's see, Corbin, do we have any?
Yeah, just turn off this so people don't see.
Yeah. Okay.
And go to questions. Yeah.
Sorry about that. I'm trying to find my way from a distance. There we go. Okay. All right. It looks like we, yeah, I'm sorry. There we go.
Okay.
Now I'll let Corbin drive again so she can see what's happening.
Oh, someone said we have a great new site. Well, thank you so much. I can tell you, Michelle Sheldon in our office really worked so very hard on that.
And we do think that we agree. We think that it's a really good new site, and it's funny. It makes it easier even for us if I want to go back in and review some of our webinars from the past. It's easy now to get right in there and go straight to it. So I highly recommend that. We've done various types of webinars, and you might find it interesting, and newsletters.
So as usual, if you guys have any questions that you'd like to send separately, please feel free to send them. My email is Corbin, C-O-R-B-I-N, Granger, G-R-A-N-G-E-R, @townbenefits.com. And Barbara is Barbara Jennings, Jennings, @townbenefits.com. But now that I think about it, they can just go to our website and click on our name.
Exactly.
So there you go. So if you think of anything and need anything, let us know. We're here to help.
Yep, we're always happy to help your clients. And if we can't, there are occasions when we have to refer people to lawyers, but we certainly enjoy talking with your clients and giving them any guidance that we can give them on their issues.
And the machine readable files inclusion in the presentation was simply for brokers. That will not be included in the employer presentation, just so you know. So with that, I think we'd just like to say, thank you so much for attending. It's just such a privilege to be able to work with all of you. And if you have anything else, let us know. And otherwise, have a fantastic afternoon.
Yep, thanks so much.